Today we're looking east. While the Western discourse around healthcare AI is often dominated by large language models like GPT and Claude, a different kind of revolution is scaling at an unprecedented rate in China. Ant Group, the fintech giant behind Alipay and an affiliate of Jack Ma's Alibaba, has elevated healthcare into a core strategic pillar going forwards. Their flagship AI-native application, Ant Afu, formerly known as AQ, has quietly moved from launch to 30 million monthly active users in mere months. The intent here is important to solve the last mile of healthcare. In China, primary care is underdeveloped, leading to massive overcrowding in urban Grade A hospitals. Ant Group isn't just trying to build a smarter chatbot, they're trying to build a digital entry point for 1.4 billion people that bridges the gap between a symptom and a solution. The vision is a closed-loop ecosystem. Unlike a standalone LLM that provides information, Ant Afu is integrated into Alipay. This means the AI doesn't just tell you that you might have a respiratory infection. It analyzes wearable data, books a consultation at one of 5,000 connected hospitals, and processes the insurance payment through the National Medical Insurance System, already linked to 800 million accounts. It is the definition of agentic healthcare. However, moving from fintech to medtech introduces important hurdles. The friendship paradox. Ant has explicitly branded Afu as an AI health friend, using anthropomorphic cues and digital twins of real-world physicians to build rapport. For a pragmatic clinician, this is where the red flags start to go up. When we blur the line between emotional companionship and clinical authority, we risk creating a kind of automation bias. If a user views the AI as a trusted friend or a digital double of their doctor, they may grant it a level of clinical trust that outstrips its actual safety profile. To overcome this, the solution isn't necessarily to strip away the user interface, but to implement algorithmic traceability. We need a hard technical decoupling of empathetic interaction from clinical recommendation. Every output should be tagged with clear evidence grade. Ant is moving in this direction with DeepSearch, a tool for clinicians that uses 36 million curated medical publications rather than scraped internet data. Integrating this level of transparency into the consumer-facing Afu app, showing exactly why a suggestion was made and which clinical guideline it follows, is a necessary step to move from a lifestyle app to a clinical tool. So what's the evidence base though? Currently we have impressive scale, but limited longitudinal clinical outcomes. We see that one obstetrician's digital avatar reportedly handled 700,000 questions in 6 months. That's a massive administrative win, but we need peer-reviewed data on triage accuracy and near-miss rates. The next essential piece of evidence is a comparative study. Does the use of Ant Afu lead to earlier diagnosis of chronic conditions, or does it simply increase the volume of low-acuity hospital visits? For a clinical audience, it's vital to be clear on the capabilities and limitations. What this system can do is handle high-volume, low-acuity administrative workflows. It can summarize patient histories, navigate insurance hurdles, and provide evidence-based literature searches for doctors via DeepSearch. It's an elite clinical assistant, but it cannot assume liability. Under Chinese law and Ant's own internal ethics, diagnosis and prescription remains exclusively the human domains. The AI aims to be a bridge, not the destination. The Ant approach provides a masterclass in ecosystem integration. By using their existing dominance in payments and identity, they've removed the friction that usually kills health tech startups. While Western developers struggle with fragmented data and siloed insurance providers, Ant has built a vertical stack that covers the patient from the first symptom right through to the final payment. The work's definitely very interesting. It's part of a bigger theme of shifting the focus from how smart a model is into how integrated it is with the workflow and what actual problems within a system it solves. As we watch this scale to 100 million users and beyond, the challenge for us in the West is to try and figure out how we can achieve similar closed-loop efficiency without the centralized super app infrastructure that Ant helpfully has at its disposal. Ant Group has shown the what and the how. Now we must provide the how to do it safely, and it will be important to see peer-reviewed evidence from independent studies to see how this impacts care for patients.